Hello guys, this is Indian Medico and in this video we are going to discuss about refractive lens exchange. Refractive lens exchange is abbreviated as RLE. It is a lens-based refractive surgery technique. It is identical to modern cataract surgery, but the difference is it is carried out in patients with clear lenses for refractive purposes. Any refractive error can be treated with refractive lens exchange, but the procedure is usually reserved for older patients with reducing accommodation, that is, patients who are older than 50 years of age. In addition to treating ametropia, toric intraocular lenses can be used to treat astigmatism, and multifocal or accommodative intraocular lenses can be used to reduce dependence on reading spectacles while doing refractive lens exchange. This image depicts refractive lens exchange. As you can see, a clear lens is removed and an intraocular lens implant is placed. Coming to the advantages of refractive lens exchange, large range of ametropia can be treated. As discussed earlier, it can be combined with toric IOLs for astigmatism, or multifocal or accommodative IOLs can be used for treating presbyopia. It is particularly appropriate for hypermetropia with shallow anterior chamber at risk of glaucoma. It is a permanent treatment for presbyopia and ametropia. Coming to the disadvantages of refractive lens exchange, it will lead to loss of any residual natural accommodation. It has a slightly higher risk of retinal detachment in high myopia compared to phakic intraocular lenses. The complications of refractive lens exchange are identical to those of cataract surgery. If you have any suggestions, please let me know in the comment section. For more such videos, please check out my playlists. Thank you.